All right, I'm back. Didn't mean to leave the last one as a cliffhanger, but that last video I posted, which was my roughly 4-month update after aortic valve replacement surgery. So this will be my 5-month, which is 6 weeks from that. But that's okay. That'll kind of make a little bit more sense as we go along. But I have no notes on this one, so I'll probably ramble, but I'm going to try to be concise. So when I made that 4-month video, I had just started back on the Benazepril to try to bring my blood pressure back down a little bit, but I was having these weird, incidences with dizziness and that kind of thing. But I thought they were starting to kind of level out. And the day I actually made and posted that last video, that night my wife and I went to see a movie, and during that time we were in the theater, I actually had to get up 3 different times and leave because I felt like kind of the walls were closing in on me, and I guess what I kind of learned, it feels like it might have been a panic attack, and so I kind of attributed that to those same feelings I was having while taking the Benazepril. So I stopped taking it that night and decided it just worth that feeling. The very next day, woke up, felt great, went to rehab, everything seemed okay then, and I actually went and walked with a friend afterwards and played golf that day, which all seemed really great and everything worked out well. And so I thought, okay, great, I'm past the dizzy spell and those kind of things. I thought everything was going to get back to, quote, normal, what it was before. I was still, paying attention to what I was eating to make sure that I was getting enough fuel, because I was still thinking it could be related to blood sugar as well, and wasn't sure. But just an overview, kind of big picture of the last 6 weeks. Again, that was the day that I posted this video, and I thought everything was good. And I'll tell you, the rest of that past 6 weeks has been very discouraging. I'll say this again during this video, that this is not advice, medical advice. This is my experience, what I've been going through. Again, just to share, so that way you can see what other people have gone through with this type of surgery. It may help you along your journey, may help somebody along your journey. Just gives you a data point. So that's what this is, not advice. This has just been my experience. So like I said, the last 6 weeks has been pretty rough. I've had multiple of those, what I call dizzy spells, because it's the only thing I can kind of really classify it as. I would have these just snap, and sometimes my vision would go dark. Multiple times it would go almost completely black, and then I would kind of have the shakes. My heart would start racing, and just felt kind of disoriented. And those would last, 10-15 minutes if I can get some food in me or something like that. It seemed to kind of help, but then I would just feel kind of groggy the rest of the day. And this probably happened half a dozen or more times over the past 6 weeks. Was just taking my normal, regimen of pills and supplements and things like that. So nothing had changed really to what I had thought. But I was still having these issues, and it happened 2 different times while I was driving, which was quite scary. And again, this is my experience, and so just kind of walk you through that. But one was actually driving back from visiting family out of state over the Thanksgiving holiday. And I was driving back with my family, and everything felt fine, and I just kind of felt that warm rush, and vision started getting black. Thankfully, I was able to pull right over safely. My wife hopped in and drove, and like an hour later, had lunch, and I felt great the rest of the day. So I'm attributing this toward what maybe blood sugar or something like that dropping out. Another time when I was driving happened 2 weeks ago. I was actually driving to rehab, which is a 10-minute drive here locally in town. I left the house, and within about 2 miles, again, my vision, I felt this warm feeling, and my vision went black. My heart started racing. I was shaking. Luckily, I was able to pull over, and even more fortunate for me, my wife and children were behind me because they were going somewhere else at the same time. So she was able to pull over. Again, thinking it was blood sugar. So, I had an orange. My wife went ahead and just took me to rehab because I thought this is, it's a great time to go in. So I was still feeling the effects of it. But I put my monitor on and just kind of sat in the chair. They monitored my blood pressure. Didn't really see a whole lot going on at the time on any of the monitor. Checked my blood sugar. My blood sugar was 113 at the time, and we attributed I could have just eaten, so that maybe what it was, but couldn't really figure out what it was that caused it. But again, the rest of the day I kind of felt groggy. On top of that, on top of those kind of big events, just over the past 6 weeks, there were multiple times, kind of even going what I felt like in the movie theater that day, where it just felt what I assumed was anxiety and almost like a panic attack. And sometimes it would come in line with one of these kind of dizzy moments, but sometimes it would just kind of come on, and I would just, again, I've never had anxiety issues before, never had panic attack issues, so if you have, it might not be what it is. This is me kind of self-diagnosing from talking to friends and kind of hearing. But I mean, basically my thoughts would just be very dark, and they would put me in a very dark place. There were times where I just felt like I had to get up and move. It was almost like a fight or flight, and my body was like, you got to do something. And that happened multiple times. It happened once when we were visiting family for Thanksgiving. It happened. It's happened a few times while driving, where I just get really anxious and feel trapped and can't move, but I need to move, and those kind of things. And I know some of this is mental because I don't know what was causing all of this, and it was scary. It legitimately was, because never had these issues before, and all of a sudden they started popping up. All that being said, I had a few of those different episodes. The whole time I'm eating to try to keep my blood sugar up, in case that's what it was. And then 2 weeks ago, so about 3 days after I had the last blackout on the way to rehab, I had an appointment on that Monday with my cardiologist, a follow-up, and then that Wednesday I had a primary care appointment to run some testing as well, just trying to figure out what was going on, because this whole thing is really cut back on the activity level I've had. I mentioned in the last one my streak of 10,000 steps. And I got it up to 121, and then it fell off because there were days I was kind of nervous to go out because I didn't want to have any of these symptoms while I was out walking or exercising or running. So it pulled those things back a good bit. But so I went to the cardiologist, talked to him, told him what was going on, and he assured me straight away. He said, listen, I saw the monitor when you wore it for the 2 weeks. I saw your echo. It's perfect, a strong squeeze. There's no issue there. And he said, I don't think it's anything heart related personally, but I want to put you on a monitor again for a couple of weeks, just so we can see, so we can look at it. And this was a different monitor that I wore before. That actually had a little button so I could record it if I felt any symptoms, so that way it would kind of mark the tape. So I put that on, 2 Mondays ago. I believe it was. It might have been 3. Yeah, it was 2 Mondays ago. It felt pretty good because, again, that assurance gave me that, but he told me that, I'm definitely hypersensitive because I just went through the surgery, and anybody that's done this probably has the same feelings. And that's something I've been battling. But, he said, just follow up your primary care and see what he says. So that Wednesday I went there and had blood work done. So I talked to him about everything. Told him all the same stuff I told the cardiologist that I've mentioned here. And he just said, I'm not going to tell you you're wrong, because we'll do some tests to make sure. He said, but I don't think this is blood sugar at all. He said, it doesn't sound like it whatsoever. He said, we're going to test that. We're going to test thyroid. We're going to test several other different things too. We'll do, full panel blood work, and kind of went from there. And we had probably a 35-minute conversation before we went through all that blood work. So anyway, we did that. All that had to be sent off. He's an independent doctor, so he's not attached to a lab, so it took a little bit of time. So that, the following Tuesday. I'm mixing up my days again. I don't have the notes, but about a week later, I got the call from my primary care, who had also given me, going back to that visit, he'd given me a glucometer and said, listen, I don't think it's blood sugar, but if you have one of these episodes, test it before you put anything in you, so that way you can see and you can rule it out pretty quickly, or say, oh, this is, you know, definitely a cause to worry about. And I did not have any of those issues during that time. And so, you know, but I did check it a couple times after long periods, and my blood sugar was always great. At the lowest I saw was the 90s, and it was usually in the 1 teens. So everything seemed to be good there. And go back and skip another step, I guess, that I did. But so that after we went to the doctor, my wife and I were talking and just, you know, scratching our head trying to figure out, hey, up until, again, that point when I made this last video, things had been going great, and then all of a sudden I started having these issues, and you know, was there anything there that I had done differently? And then it struck me, the only thing that I had done differently that really coincided exactly timing-wise was I was taking the supplement with magnesium. And so again, going back to what I said in the last video, you got to educate yourself. So don't take this as medical advice. It was recommended to me. I trusted, I tried it, and I started looking up some of the symptoms of maybe, you know, if you had too much magnesium, what it could do, or even the supplement I was taking, that there is a moderate interaction that's listed that could cause dizziness and a drop in blood pressure, and some of these things that could have caused the same issue. So I stopped taking that. And then, now I'll finish the story, and then about a week later, the doctor calls back, my primary care, and says, hey, have you had any more of those episodes? And I said, no, I haven't. You know, I stopped taking this magnesium, and it seems to have kind of gone away. I've had a couple of, you know, interesting feelings. I did have one time where I felt that kind of anxiety come back on, attributing that to maybe it was just getting out of my system. And he said, okay, well, we're going to say that might be what it is. He said, I don't know if that's what it is, but all your blood work came back perfect. He said, you know, I couldn't ask for a better results from all this blood work for any of my patients. So my A1C was 5.1. Thyroid panel came back good. There was no real deficiencies anywhere in anything. Nothing he can see that would cause it. And he said, you know, we can keep looking, but you know, I said, I'd keep him posted. A couple days before that weekend, the monitor they put on me, I guess my skin just doesn't want to hold on to anything. It started coming off. The nurse that put it on said this should stay for 2 weeks. I've only had a couple of them not last that long, and I guess I'm the third one. So I called the doctor, the cardiologist, on Monday morning, and he said, and they said, you know, 1 week's probably good enough. Go ahead and send it in. So fast forward to this past Friday, so it's about a week later. I got a call from, you know, my cardiologist was on vacation, so I got a call from his backup and said that there was a couple of runs of VTAC, or this ventricular tachycardia, that were a little bit longer. I've shown some of these in the first monitor and during some of my rehabs, but they've all been 3 or 4 beats, at most 5 beats has been pretty quick, and so it's not been really a concern. But he said it was a little bit longer. He said that they don't have the full results in, but the monitor company just called and said that. So he said, I'm going to call in a beta blocker, call in metoprolol for you. And he said, just follow up with your doctor on Monday. And so that's what I did. I called my cardiologist actually called me 3 days ago now. And the nurse did, and said, you know, here's what we saw. And I told her that the other doctor, the backup, had called in the beta blocker. And she said, okay, let me go back and talk to your cardiologist just to give him an update and see. And he came back later in the day to say, look, don't take the beta blocker. I'm going to get the full results, and I'm going to read them, and then I'll call you back and let you know. So that was Monday afternoon. Again, my cardiologist was actually on vacation, so I appreciate what he dedicated his time to doing there. And then I got a call yesterday morning from the nurse that said, okay, your doctor looked at it, and he said that there was a couple of VTACs that lined up with when you press the button for one of these symptoms. and one of them was 20 seconds long. And so, the doctor said, I do want you to start taking the beta blocker. He put me on 25 milligrams at night and in the morning, and basically to kind of help that, to control that, bring my heart rate down, because those VTAC episodes can do some serious damage the more I've been looking into it. So all that being said, here we are again. Last night I took my first dose of the metoprolol, and one of the things that I was reading about it, as I was kind of reading through directions and those kind of things, is it can, and again, this is what I read, not at all advice, but it can also help with anxiety, because the way I guess it works is it blocks off adrenaline from your heart, and I think kidney, just in that blocks on this beta blocker, and so that can basically keep your heart from going into those fast rhythms, and kind of give you that fight or flight mentality, which is really kind of what I've felt in some of those times, in those kind of panic attack, anxiety areas as well. So I took it last night and felt fine, felt completely good, went to bed, woke up this morning, took my next dosage, and came down here to my office to do work. Thankfully, I was supposed to be in my office an hour away today, but my boss said, hey, take time, don't try to come in since you're taking a new medication. So, which was good, because I got down here and within about 5 minutes of sitting at my desk, I felt a warm rush and then some dizziness. And so I went upstairs and just kind of sat for a little while, and it didn't feel exactly like the old ones. I didn't have the blackout. It was more of just dizziness. And then afterwards, I felt calm and fine. So I didn't have that anxiety afterwards. So my thought is, probably it hasn't gotten all the way into my system yet. It could be the side effect, because the beta blocker can cause that dizziness, especially it looks like in the first couple weeks. So I'm going to keep an eye on that, and keep my doctor updated and that kind of thing. But so far today, outside of that, I felt okay. I'm still honestly, I'm still fighting the nervousness to get out and do much of anything, which works out today because it's a very cold day here. And so, that's been, again, it's been tough. The last 6 weeks has been tough. I mean, I'm thankful that I'm healthy, but all these episodes of, whether it's the VTAC, whatever was actually causing this, if it was something else that triggered the VTAC, I don't know exactly what it was. I'm not sure if I'll get that answer. But I feel good now about the direction we're going through from the cardiologist, but it's been rough. Again, I'm healthy, but all these events have been scary and put a lot of stress on me, that probably caused them to happen more. That put stress on my wife, because obviously she has to be aware of what's going on, and so it's not been a fun 6 weeks. I've been able to do some things. Like I said, I played golf, which was great. I didn't have any pain playing golf. I was doing strength training up until the last video, and then I kind of stopped because I didn't want to have any kind of dizzy episodes. I've done a little bit more of that recently. I've run a tiny bit, so that's been good, but for the most part I've been way down from where I was exercise wise, because again, I don't want one of these events to happen. Driving still makes me nervous, and so any chance I get, I ride in the passenger seat, so those are things mentally I've got to get over. Another big thing is I finished my cardiac rehab last week. I was able to finish the 36 sessions there, and could not say enough good things about the rehab program here and the nurses that ran it. Super caring, really tried to work with me to figure out different things and help me test different things along the way. So that was, it was kind of a bittersweet day to graduate, because moving on from something I spent quite a bit of time doing. But while that's a great thing, because of all these other symptoms and weird episodes I've had, I'm still a little bit on edge and working through that mental state. And I'm very hopeful that starting the beta blocker will help that for the various things that it does. You know, I was able to not be on one for the first 5 months, but you know, it seems like most folks I know get put on one after a heart surgery. So, you know, it almost feels a little relaxing to know, like, okay, I'm not this weird different thing out here that, but you know, I'm on that. So we'll see what that does. I'll do another update at a month unless something crazy comes up, to do the 6-month update. And in the meantime, that, you know, I'm just going to continue to try to push forward. A few of the things that I'll give as my personal experience while I've been kind of battling these things is, you know, talk to somebody. I've talked to my wife a lot. I've talked to friends. I've shared this with friends in my community at church, and they prayed over me, and continue to do that to help fight whatever this is, especially the mental aspects, because never experiencing anxiety or panic attacks before in my life, or anything at all, could be classified as similar to what I've been in the last 6 weeks. You know, it is. I feel great, you know, empathy now for anybody that goes through that, because it is a dark and rough spot to be. So, you know, I'm going to continue to do that, share and talk, and have that community around me, to hopefully get over that. And in saying all that, you know, the last 6 weeks hasn't been all doom and gloom, thankfully. It's been spots, maybe 1 or 2 times episodes a week, where this would happen. And so I'm hoping that as the beta blocker gets in my system and gets to that therapeutic level, which I have read could take about a week, you'll see some effects pretty well, you know, after you start taking it, but maybe about a week before it gets in. So I'm hoping that'll all kick in, and really hoping that this will get me back to the activity level I want to be at, where I can feel comfortable when I go out for a walk or a run, and I can get back into doing some weights and some of that. Because I think the most discouraging piece to me is that first 3.5 months, I felt like my recovery, while it started down here, and if you see my early videos, it was pretty rough. It had jumped up. I mean, I was quite active and doing a lot of stuff and felt great. And then this happened, and again, I don't know what triggered it. Could have been the supplement I was taking, sure. Could have been exercise. It could have been just my heart going into that rhythm. I don't know exactly, but again, I feel like we have a plan going forward, and that's, you know, where we are at this point. You know, overall, you know, I'm fighting to remain really optimistic as much as I can, even through the rough parts, because I think that's a huge piece too. So again, this has been my experience. So, you know, whether you're going through it, getting ready to go through it, have a family member, just know recovery doesn't always look the same. It can go up and down. And, you know, I just encourage you to talk. If you be there for somebody, if it's a family member or a friend that's going through this, or vice versa, you know, just be there and listen. It's tough. There's a lot of questions, but, you know, I can also say on the other side, I've got a good friend now that's about a month behind me on his journey, and he seems to be going great. So everybody recovers differently. Everybody's experience is different. Again, everything seems to be great. The way internally I'm working, it's just we're trying to figure out whatever's causing this VTAC and get that calmed down. So hopefully that'll all go away, and I'll be able to get back to normal. I'm excited because we're right around the corner from Christmas, so we're going to have family in town and do that, and you know, hopefully these episodes kind of will pass, and I'll fall into my normal routine again, and that is my hope. I thank you all for watching. Again, I hope, if nothing else, these videos are helpful. I'm not sure if they're very entertaining because it's just me sitting in the same spot every time now, but you know, I hope they're helpful. I appreciate anybody that comments along the way. It's nice to know that there are others out there, and again, any of this that can make your experience better or just help you understand more what a friend or a family member may be going through is great. So thank you for watching. Next video will be in a month, at the 6-month mark, unless something else is changes, and if that's the case, I'll try to make something short. So thank you again for watching, and we'll see you in about a month.